Good morning, viewer. Beyond the share. Yes, breaking news. Yes, chronic low-level lead poisoning is a major risk factor for cardiovascular disease in adults and cognitive deficits in children, even at levels previously thought to be safe, according to a paper by Columbia University, Mailman School of Public Health, Simon Fraser University in Canada, and Harvard Medical School and Boston Children's Hospital. Low level lead poisoning is a risk factor for preterm birth, cognitive deficits, and attention deficit hyperactivity disorder that's called ADHD, as well as increased blood pressure and reduced heart rate variability. The findings are published in the New England Journal of Medicine. In children, exposure is responsible for an annual loss of some 765 million IQ points in children globally. Low level lead poisoning is a risk factor for adults which can result in chronic kidney failure, hypertension, and cardiovascular disease. Lead accounted for 5.5 million deaths annually from cardiovascular disease too. The global burden of disease from lead exposure is staggering, and Anna Navasesian, MD, PhD, Leon Hess, professor on the chair of environmental health sciences at Columbia Mailman School. In contrast to the decline in the rate of coronary heart diseases in industrialist countries, the rate has increased over the past 30 years in industrialized countries. One in three children worldwide, more than 600 million children, have lead poisoning. Lead is readily absorbed by rapidly growing infants. In adults, 95% of retained lead in adults is stored in the skeleton. Factors such as menopause and hyperthyroidism release lead sequestered in the skeleton, which causes a spike in blood lead concentration. The steep decrease in IQ and the sharp increase in the risk of death from cardiovascular diseases, even at the lowest measurable blood and concentrations, coupled with pervasive exposure, indicate that population strategies are critical for eliminating lead poisoning, said Bruce Lanfear of Simon Fraser University and corresponding author 2. Well, lead exposure has declined by nearly 100% since 1970 and is no longer used in the US and Europe. Physicians assume that lead poisoning is a problem of the past. Yet, exposure lingers from lead paint in older houses, leaded gasoline in soil, seeping lead from water lines, and emissions from industrial plants and incinerators. Beyond this exclusive report.